The National Agency for the Control of AIDS says it is a bit hasty in declaring that Nigeria has achieved endemic status, but the nation is rather approaching the status level. It, however, believes that with the over 2,000 functioning HIV service centers across the country, the nation can achieve the Unaids target by the year 2025. Health correspondent Kemi Balogun has details.
Elizabeth is the team lead and community case manager for people living with HIV and AIDS within the Mabuchi area of the FCT for the Institute of Human Virology in Nigeria. She admits that encouraging people to get tested and be put on treatment has greatly increased due to the recent decrease in stigmatization.
Nobody is afraid of the name of HIV anymore, because like before, you go out for mobilization when after talking to them, they refuse coming out. But now, they are ready.
The United Nations program on HIV and AIDS believes that rapid progress must be made in order to achieve the 2030 target of ending AIDS. This will be done through ensuring that 95% of people know their HIV status, 95% of these people are put on treatment, and also 95% will achieve viral load suppression. Earlier this week, the National HIV and AIDS Viral Hepatitis and STI Control Program had declared that the burden of HIV and AIDS in the country has transitioned from being a pandemic into an endemic stage.
We are progressively moving.
But as much as this is cheering news, the National Agency for the Control of AIDS says this is not yet the case.
We are approaching that state of endemicity, but we are not there yet. Still, HIV globally is a public health concern, and we are still in the emergency mode.
The agency says Nigeria's response is in line with the 2030 UN AIDS target. The Director General of NACA also reveals that in the last 2 years, the agency has been working tirelessly, putting mechanisms in place to ensure that the HIV/AIDS response program is sustained in order to achieve the agency's 95-95-95 target by 2025.
80 to 81% of people that live with HIV in the country should have that virus control in them. If that is achieved, then death from HIV will reduce and will no longer be seen.
While there have been recorded gains in rolling back the epidemic, the total number of people affected by AIDS remains slightly high, and people living with the disease, like Elizabeth, believes the challenges affecting timely interventions for HIV and AIDS will soon be over. Kemi Balogun, TVC News, Abuja.